One of the more common reasons why someone comes to me is for a passing out spell. Another term for this is syncope. So there's a specific one that I see a lot, and people need to know more about this. This is termed as vasovagal syncope. So the typical story is something happened that triggered them to pass out. A lot of times people who are getting lab work, when they see the needle or when they see blood being drawn, they pass out. When someone gets startled, they pass out. When someone experiences significant amounts of pain, they pass out. So this is vasovagal syncope. So why does this occur is going to be the biggest thing. And it's basically a fight or flight response, and yours decides to just slow things down. What happens is when that stimulus happens, when that trigger happens, your heart rate comes down and your blood pressure, or your arteries dilate. When this happens, it lowers your blood pressure. Unfortunately, by doing this, it actually decreases perfusion to things such as the brain, which can make you feel lightheaded, dizzy, and sometimes pass out. So when someone is having an episode where they passed out after seeing blood, the most likely etiology is from a vasovagal syncope. Ways that we can treat it is kind of understanding the prognosis of it. People don't die from it. People have a really good prognosis, but just have to be careful in the scenarios, the situations that somewhat triggers them. But I find that I do have a lot of patients that, even though I educate them on ways to prevent it, or just to know more about it, knowing that the triggers for it, they still experience discomfort with it. So what other things that can we do? There's certain exercises that we can do to cross their legs, to squat. But if you're experiencing it acutely, if you're starting to feel lightheaded and you're about to pass out, the best thing you can do is actually lay down. By laying down, you increase the perfusion to the blood in the head, in the brain, preventing you from passing out. Another thing is exercising, strengthening the leg muscles. So I put people on an exercise regimen for them to do it routinely, anywhere from 3 to 5 times a week, to build that muscle and hopefully prevent these episodes from happening. And the third one is, I try not to reach for it as much as I can, is medical therapies. There are some medications that can help with this. It helps to improve the blood pressure. Medications such as midodrine and fludrocortisone can be very helpful for this. And if those ones are not working, if people are still having episodes despite that, and I try to send them to an autonomic center that can help with it, a center that focuses on issues with the blood pressure, issues with the heart rate and the blood pressure. One of the biggest ones in the surrounding areas is Vanderbilt, even though they're pretty booked for a long period of time. So try best to treat it, to understand the pathophysiology and certain maneuvers that you can do and ways that you can treat it acutely, such as laying down, medications that you can utilize. And I hope that if anybody found any benefit in this, let me get a thumbs up, and let me know what you guys have done for your vasovagal syncope or your lightheadedness and dizziness when you experience these symptoms.